This flu season is tough, and we need to talk about it some more. So we have Dr. Preston Wilson here from Mountain Star Medical Group, the Jordan Family Health location, to talk to us about the flu and what all of us can do to try to lessen the blow of this nasty, nasty stuff. You were just telling me during the break that this year is bad, and every year is bad, but it's really bad this year.
Yeah, I've read certain reports that say that this is probably worse than the last 10 or 15 years. Now, they haven't been collecting data that long, but they said this year, 2017 was considered one of the worst years, almost 6,000 deaths, and we will surpass that easily this year in this country.
And are you seeing a lot of people coming with the flu into your practice?
Yeah, I saw 4 patients today.
Wow, that's crazy.
Yeah.
So now, as people are out there, what can we do to try to prevent ourselves from getting the flu? A lot of us just kind of think it's going to happen, but there are things we can do to try to lessen the blow a bit.
Right, and I think it's important to understand that, for you and I who don't have a whole lot of health problems, the flu is just a bad week for us. But there are certainly a bunch of people out there who have chronic lung disease or kidney problems or other just problems that make the flu literally a life and death situation. And so prevention really is the key. And number one is get your flu shot. We know that decreases the risk of catching the flu, or if you do catch the flu, it decreases the severity.
Which I think is an important thing to remember, because a lot of people think, oh, I'm going to get it anyway, but if it decreases the severity, that in of itself, to me right there, is a major selling point.
Right. Imagine being out of work for a week, or if your child gets it, they got to stay home from school, you got to stay home from work. There's a huge burden, not just from a health perspective, but from a financial perspective as well. And so, yeah, prevention is the key. And if you got your flu shot or for some reason can't get it, then wash your hands. If you're sick, stay home. If you have a child that's sick, keep them home from school. And again, a lot of this you may not end up in the hospital, but heaven forbid you give it to somebody and they do.
And let's talk about kids, because when it comes to the flu in kids, I think sometimes they can't tell us how severe it is, and so we might feel like we're not taking it serious enough. So what are some ideas for our children when they start to come down with flu-like symptoms?
It's a great question. So the flu is not just any common cold, right? Cough, runny nose. The flu is the common cold on steroids. So this is your child wakes up in the middle of the night and all of a sudden they have a fever and they're coughing and they've got a sore throat and they just look like death. That's the flu, and you really should have them evaluated as soon as possible at that point, because if we can initiate treatment within the first 24 to 48 hours, we know that we can make an impact in terms of decreasing the duration of symptoms.
Wow.
Beyond that, you really kind of have to gut it out, unfortunately.
Which is unfortunate. So the big message, get the flu shot and just kind of beware.
Absolutely.
Okay, thanks so much for joining us today.
Thank you so much.
We really appreciate it. For more information, of course, you can go to our website, abc4.com, and when you're there, we will link you with Mountain Star.